Aarskog syndrome is a rare genetic disorder. It primarily affects the development of a child's face, limbs, and genitals. This condition is more common in boys than in girls. Imagine a world where a child's physical development takes an unexpected turn, presenting unique challenges and opportunities. This is the reality for those living with Aarskog syndrome, a genetic disorder with a profound impact on physical characteristics and overall well-being. Aarskog syndrome is caused by a mutation in the FGD1 gene. This gene plays a crucial role in embryonic development. The mutation disrupts the normal signaling pathways, leading to the characteristic features of the syndrome. Understanding the genetic basis of Aarskog syndrome is crucial for accurate diagnosis and the development of potential targeted therapies. While the exact prevalence of Aarskog syndrome remains unknown, estimates suggest it affects approximately 1 in 25,000 to 30,000 individuals worldwide. Despite its rarity, Aarskog syndrome serves as a reminder of the intricate nature of human genetics and the profound impact of genetic variations on our lives. This essay will delve into the intricacies of Aarskog syndrome, exploring its symptoms, causes, diagnostic methods, management strategies, and the importance of early intervention. Join us as we unravel the complexities of this rare disorder and shed light on the path towards improved care and support for those affected. Aarskog syndrome presents a constellation of physical characteristics that often become apparent during infancy or early childhood. These distinctive features serve as crucial clues in the diagnostic process, enabling healthcare professionals to recognize the syndrome and initiate appropriate care. One of the most noticeable signs of Aarskog syndrome is facial dysmorphia, characterized by a unique set of facial features. These may include a round face, widely spaced eyes, a broad nasal bridge, a short upturned nose with nostrils that are visible from the front, and a widow's peak hairline. These facial characteristics contribute to the distinctive appearance associated with Aarskog syndrome. In addition to facial dysmorphia, individuals with Aarskog syndrome often exhibit skeletal abnormalities. Short stature is a common finding, with affected individuals typically being shorter than their peers. The arms and legs may also be disproportionately short, further contributing to the overall short stature. Genital abnormalities are another hallmark of Aarskog syndrome, particularly in males. Undescended testicles are frequently observed, and the scrotum may be underdeveloped, taking on an unusual appearance. These genital abnormalities can have implications for fertility and may require medical intervention. While the exact causes of Aarskog syndrome are not fully understood, it is primarily attributed to genetic mutations. Specifically, mutations in the FGD1 gene located on the X chromosome have been strongly linked to the syndrome. This gene plays a vital role in embryonic development, particularly in the formation of tissues and organs. The FGD1 gene provides instructions for creating a protein that is essential for cell signaling. This protein interacts with other proteins to regulate various cellular processes, including cell growth, differentiation, and migration. Mutations in the FGD1 gene disrupt these intricate signaling pathways, leading to the developmental abnormalities characteristic of Aarskog syndrome. Diagnosing Aarskog syndrome involves a comprehensive evaluation that encompasses clinical examination, family history assessment, and genetic testing. By carefully considering these aspects, healthcare professionals can accurately identify the syndrome and provide appropriate guidance and support. The diagnostic journey often begins with a thorough clinical evaluation. During this examination, the healthcare provider will meticulously assess the individual's physical characteristics, paying close attention to facial features, limb proportions, and genital development. By comparing these observations to the established diagnostic criteria for Aarskog syndrome, the provider can gain valuable insights. In addition to the clinical examination, obtaining a detailed family history is crucial. Since Aarskog syndrome is a genetic disorder, understanding the family's medical background can provide valuable clues. The healthcare provider will inquire about any history of Aarskog syndrome or related conditions within the family, as this information can significantly contribute to the diagnostic process. Genetic testing serves as the gold standard for confirming a diagnosis of Aarskog syndrome. This involves analyzing the individual's DNA to identify any mutations in the FGD1 gene. The most common method employed is gene sequencing, which allows for the detection of specific mutations within the gene. Gene sequencing involves determining the precise order of nucleotides, the building blocks of DNA, within the FGD1 gene. By comparing the individual's gene sequence to a reference sequence, any variations or mutations can be identified. These mutations can then be analyzed to determine their potential impact on gene function and their likelihood of causing Aarskog syndrome. The results of genetic testing provide definitive confirmation of the diagnosis and offer valuable insights into the specific mutation involved. This information is crucial for genetic counseling, as it allows healthcare professionals to assess the risk of passing on the syndrome to future generations and guide family planning decisions. Section 4. Managing Aarskog syndrome. Traditional approaches. Managing Aarskog syndrome requires a multidisciplinary approach that addresses the diverse range of symptoms and potential complications associated with the disorder. Traditional treatment strategies focus on alleviating symptoms, improving functionality, and enhancing the overall quality of life for individuals with Aarskog syndrome. One of the primary goals of management is to address any orthopedic concerns. As skeletal abnormalities are common in Aarskog syndrome, orthopedic interventions aim to correct or minimize these issues, improving mobility and preventing long-term complications. For instance, if an individual experiences difficulty walking or running due to leg length discrepancies, orthopedic braces or surgery may be recommended. Braces can help to align the limbs and improve gait, while surgery can involve procedures such as epiphysiodesis, which slows down the growth of the longer leg, or limb lengthening, which involves surgically lengthening the shorter leg. In addition to orthopedic management, surgical interventions may be necessary to address specific genital abnormalities. For example, if an individual has undescended testicles, known as cryptorchidism, a surgical procedure called orchiopexy is typically performed. This involves bringing the testicles down into the scrotum and securing them in place. Orchiopexy is crucial not only for cosmetic reasons, but also for the long-term health of the individual. Undescended testicles are at an increased risk of developing testicular cancer, and bringing them down into the scrotum allows for easier monitoring and earlier detection of any abnormalities. Furthermore, if an individual experiences breathing difficulties due to a narrow nasal passage, surgery may be considered to widen the airway. This procedure can improve breathing and reduce the risk of sleep apnea, a condition characterized by pauses in breathing during sleep. Section 5. Exploring complementary therapies. A note of caution. In the realm of Aarskog syndrome management, while conventional treatments like surgery and physical therapy take center stage, some individuals and families explore complementary and alternative therapies. These therapies, ranging from acupuncture to herbal remedies, are often sought to alleviate specific symptoms or enhance overall well-being. Acupuncture, rooted in traditional Chinese medicine, involves the insertion of thin needles into specific points on the body. Proponents suggest that it can help manage pain, reduce stress, and improve energy flow. However, it's crucial to approach acupuncture with caution, especially for individuals with Aarskog syndrome who may have underlying health conditions. Herbal remedies, another popular avenue in complementary medicine, utilize the therapeutic properties of plants and botanical extracts. While some herbs have shown promise in managing certain conditions, it's important to note that herbal remedies are not without risks. The use of herbal supplements in individuals with Aarskog syndrome should be approached with extreme caution and only under the guidance of a qualified healthcare professional. Some herbs can interact with medications or exacerbate existing health conditions, underscoring the need for careful consideration and medical supervision. While the allure of complementary and alternative therapies can be strong, it's paramount to remember that these approaches should not replace conventional medical treatments. Instead, they should be viewed as potential adjuncts to the established medical care plan. Open communication with healthcare providers is essential when considering complementary therapies. By informing their medical team about any alternative treatments they are using or considering, individuals with Aarskog syndrome can ensure that their overall care plan is well coordinated and safe. Section 6. Navigating Aarskog syndrome. Essential precautions. Navigating the complexities of Aarskog syndrome requires not only a comprehensive understanding of the disorder, but also a proactive approach to healthcare and well-being. By taking essential precautions and embracing a proactive mindset, individuals with Aarskog syndrome can mitigate potential risks, optimize their health, and live fulfilling lives. Regular medical checkups are paramount for individuals with Aarskog syndrome. These checkups provide an opportunity for healthcare providers to monitor the individual's growth and development, assess any new or worsening symptoms, and make necessary adjustments to the treatment plan. During these visits, the healthcare provider will likely measure the individual's height and weight, track their progress on growth charts, and conduct a thorough physical examination. They may also order blood tests or other diagnostic procedures as needed to monitor overall health and screen for any potential complications. In addition to regular medical checkups, early intervention for developmental delays is crucial. Aarskog syndrome can sometimes be associated with developmental delays in areas such as speech, language, and motor skills. Early identification and intervention can make a significant difference in a child's developmental trajectory. If developmental delays are suspected, the healthcare provider may recommend a referral to a specialist, such as a speech therapist, occupational therapist, or developmental pediatrician. These professionals can assess the child's developmental milestones, identify any areas of concern, and develop individualized intervention plans to address those needs. Furthermore, genetic counseling is an essential aspect of care for individuals with Aarskog syndrome and their families. This specialized counseling provides information about the genetic basis of the disorder, the inheritance pattern, and the risk of passing it on to future generations. Genetic counselors are trained healthcare professionals who can help families understand the implications of genetic testing, interpret test results, and make informed decisions about family planning. They can also provide emotional support and guidance as families navigate the challenges associated with a genetic diagnosis. Section 7. Early Intervention, Brighter Futures. The Importance of Timely Care. In the tapestry of Aarskog syndrome, early diagnosis and comprehensive care emerge as the golden threads, weaving a brighter future for those affected. By recognizing the early signs, seeking prompt medical attention, and embracing a holistic approach to management, individuals with Aarskog syndrome can overcome challenges and live fulfilling lives. Early diagnosis serves as the cornerstone of effective management. When Aarskog syndrome is identified early, healthcare professionals can implement interventions promptly, addressing potential complications and optimizing developmental outcomes. This proactive approach can make a world of difference in the lives of individuals with the syndrome. Comprehensive care encompassing medical, developmental, and psychosocial aspects is essential for addressing the multifaceted nature of Aarskog syndrome. By adopting a holistic perspective, healthcare providers can tailor treatment plans to meet the unique needs of each individual, fostering their overall well-being. Support groups and online communities provide invaluable platforms for individuals with Aarskog syndrome and their families to connect, share experiences, and access emotional support. These networks foster a sense of belonging and empowerment, reminding individuals that they are not alone on their journey. Through early diagnosis, comprehensive care, and unwavering support, individuals with Aarskog syndrome can navigate the challenges they face, embrace their strengths, and live meaningful and fulfilling lives. By fostering awareness, promoting understanding, and advocating for improved care, we can create a brighter future for all those touched by this rare genetic disorder.